Hello everyone. In this video, we are going to look at infant nutrition regarding energy and nutrient needs of infants. By the end of this lecture, I expect the students to be able to discuss the energy and nutrient needs of infants, understand complementary feeding of young children from 6 months and above, explain infant feeding skills, explain the nutrition-related problems that affect infants. A newborn infant or a neonate is a child under 28 days of age. And during these first days of life, the child is at a very high risk of dying. So it is always very important that appropriate feeding and care are provided during this period, both to improve the child's chances of survival and to lay the foundations for a healthy life. So why are nutrients so important? Why is nutrition very important for a child? Nutrition is not only important for children, but for all people of all age groups. That is why nutrition through the life cycle is a very important aspect of life. Nutrition helps to provide energy for daily life, maintains all the body functions. It is through the nutrients obtained from eating nutritious foods that the body can sustain all its functions. Nutrition is also vital for growth and development, and there are also therapeutic benefits of nutrition such as healing and prevention of disease. Energy needs of children, infants. Young children from birth up to 6 months require about 108 kilocalories per kilogram of body weight per day. And from 6 months to 12 months, the energy requirements decline a bit to 98 kilocalories per kilogram per day. There are a lot of factors that may influence calorie needs of infants, and these include weight and growth rate, the sleep or wake cycle, temperature and climate, physical activity, metabolic response to food, and the health status of the child. The needs for children above 6 months. The energy content of some foods, for example bananas, potatoes, yams and cassava, can be boosted by drying them and then milling to form flours. And these children's food should always be mashed to form a thick paste. And how do you know the consistency of this paste? If you get a spoonful of this porridge or soup or pureed food and you turn it sideways, it should fall in lumps. And this will be a clear indication that your portion of food for this child is thick enough. The child should be able to consume the paste without choking. You can also add cooking oil to the children's foods to boost the energy content. And it's always very important to use good oils, for example sunflower, fish oil, peanut butter oil, and some other good oils that you know. You may not necessarily have to fry the children's food, but it's important to add foods that are rich in fats or oils. And healthy sources of fats and oils may include avocado, milk, meats, peanut butter, groundnuts, and margarine. Children from 6 months to 8 months should eat 2 to 3 tablespoons of porridge or pureed food per meal. And this starts with tests and gradually increase in the amount to about half a cup. From 9 months to 11 months, the child should eat half a cup or bowl of soup or food. And the children aged from 12 months to 18 months should eat 3/4 and gradually increase the amount to 1 full cup, that is 250 ml cup or bowl. Sweets provide a lot of energy, and so they should be consumed in moderation or sparingly. The best sources of sugars to children are fruits because they are able to provide other nutrients, for example, vitamins and minerals. And it is better to provide the fruits as snacks or mixed with other fruits if possible. Protein needs. Children from birth to 6 months will require 2.2 grams per kilogram per day. And from 6 to 12 months, they will require 1.6 grams per kilogram of body weight per day. And how much is that if you to calculate in relation to the child's weight? A newborn child weighing 4 kilograms needs 2.2 grams times the child's weight, which is 4 kilograms, and that will be about 8.8 grams of protein per day. A 6-month-old child weighing 8 kilograms will need 1.6 times 8, and that is going to bring to 12.8 grams of protein per day. The factors that influence protein needs are similar to those factors that influence energy needs. The only difference is in the body composition. For children above 6 months, it's important to combine cereals with legumes to ensure complementarity of the essential amino acids. For example, legumes have low levels of methionine, and cereals have low levels of lysine but high levels of methionine. So if you complement these proteins, you give the child a legume like beans, and in combination with cereals such as rice or maize, the child is going to be able to obtain both methionine and lysine amino acids. Use dry legumes because they have a high protein value than the fresh legumes. And you always have to mash the legumes to form a thick paste for children 6 to 12 months. It is better to eat plant protein foods with animal protein foods in order to increase the absorption of the non-heme iron from the plants. For example, combining silverfish with beans. For non-breastfeeding children, you have to provide a full cup of 500 milliliters of milk per day. And for breastfeeding infants, cow milk should not be given to a child until he or she is 12 months. In infants, the introduction of cow's milk in the first year of life is one of the greatest dietary risk factors for the development of iron deficiency and iron-deficiency anemia. Cow's milk is very low in iron, and its iron is very poorly absorbed. That is why it's not recommended for these young children, because they require a lot of iron. And again, it decreases the absorption of iron from the other dietary sources. So it's very risky to provide your child with cow's milk. If a mother is HIV positive and the child is negative, the mother should breastfeed to a maximum of 1 year while taking the ARVs as recommended. If both the mother and the child have HIV, then breastfeed the child to a minimum of 2 years. Mothers should avoid giving children tea or coffee with food, as it has anti-nutrients that can limit the absorption of iron and other nutrients. Avoid putting tea leaves in milk. Children need animal source foods daily. And to maximize this, a household can be able to buy cheaper cuts of meat more frequently. For example, organ meat such as liver. And these meats can be mixed with other foods in order to increase the quantity of the sauce. Fat needs. There are no recommendations on fat intake by infants, and therefore there are no restrictions. But it's always very important for the children to consume those fats that are rich in non-saturated fats to avoid future development of cardiovascular disease. Cholesterol intake should not be limited in infants because it is very crucial and there is a high need for it because of its relation to metabolites in the gonad and brain development. Breast milk contains about 55% calories from fat, and it contains mostly short chain and medium chain fatty acids in addition to the long chain. So it is easier to digest and utilize compared to the long chain fatty acids that are present in infant formulas. Metabolic rate in relation to calories, fats, and proteins. The metabolic rate of infant is highest just immediately after birth, and this higher rate is related to the rapid growth and development and a high proportion of muscle being built in the child. Low carbohydrate or energy intake in this infant will result in protein catabolism, which will impact growth, because proteins are very essential for maintaining growth and development and repair of worn-out tissues. So if there is restricted calorie intake and fat intake, and the body resorts to mobilizing proteins for energy, then it is going to be very risky for the growth and development of this child. Other nutrients, for example fluoride, will be required in an amount of about 0.1 to 0.5 milligrams per day, depending on age. And too much of it is not good because it may cause tooth discoloration. Vitamin D is required at 400 international units per day. Sodium, 120 milligrams per day. There are no recommendations for fiber. And lead. Too much lead may be toxic to the child. Feeding in early infants. Breast milk and formulas. It is recommended that a child is exclusively breastfed from the first day of life up to 6 months, and breastfeeding should continue up to 1 year. Breastfeeding should be initiated 1 hour after birth. The growth rate and the health status of an infant indicate the adequacy of milk volume. Standard infant formulas provide about 20 calories, and preterm formula provides about 22 to 24 calories. Breast milk contains 7% of calories from proteins, and 38% calories from carbohydrates, and 55% calories from fat. And cow's milk contains about 9 to 12% calories from proteins, 41 to 43% calories from carbs, and 48 to 50% calories from fat. So you find that cow milk based formulas are modified in relation to breast milk itself, so that the baby can be able to obtain all the nutrients that are present in the breast milk. During infancy, it is important to feed the child with whole reduced fat or skimmed cow's milk, and this should be avoided during early infancy. Should be introduced later on from about 1 year. Iron-deficiency anemia is linked to early introduction of cow's milk, and this anemia can cause gastrointestinal blood loss, low absorption of calcium and phosphorus, and displacement of iron-rich foods. Soy protein-based formula during infancy. Soy protein in place of milk protein should be limited in its use. It is not recommended to use soy formula for managing infant colic, and it's important to use lactose-free and hydrolyzed formulas for infants that are not able to breastfeed or be fed cow's milk formulas. Development of infant feeding skills. Infants are born with reflexes and food intake regulatory mechanisms, and there is always an inherent preference for sweet tastes compared to bitter tastes. At about 4 to 6 weeks, the reflexes fade and infants begin to purposely signal wants and needs. And infant schools may signal infants' feeding readiness. For example, some of the cues that may give an infant or may signal that this infant is ready or desires to breastfeed or to eat any kind of food. Watching the food being opened in anticipation of eating. Tight fists or reaching for spoon. Irritation if feeding is too slow. Playing with the food or the spoon. Slowing eating and turning away when the child is full. Stopping to eat or spitting out food when full. All these are cues that can signal different desires for feeding in a child. Introduction of solid foods. Food offered from spoon stimulates muscle development. And at 6 months, you have to offer small portions of semi-soft food on a spoon once or twice each day while you continue breastfeeding. Some recommendations for introduction of solid foods. The infant should not be overly tired or hungry. Use a small spoon with shallow bowl. Allow the infant to open the mouth and extend the tongue. If the baby cannot extend the tongue further out than the lower lip, then the baby is not ready for spoon feeding. Place the spoon on the front of the tongue with its gentle pressure. Avoid scraping the spoon on infant's gums to remove food from it. You have to allow pace feeding to allow the infant to swallow to avoid choking. The first meals may be 5 to 6 spoons over 10 minutes. Complementary feeding is more than just food. It's always very important to use the rule of FATVA in complementary feeding. And by FATVA we mean frequency, that is frequent feeding. The child should feed frequently. The child should not feel hungry for you to give the child something to eat. But any time, adequate amounts of food should be provided to the child. Texture. The food should be of a thick consistency. Variety of different foods. You have to provide the child with food from different food groups. Active, responsive feeding. The child should be actively breastfed or given the complementary foods. Hygiene. The foods to be given to the infant should be hygienically prepared. The importance of infant feeding position. An improper feeding position may cause choking, discomfort, and ear infections. Spoon feeding should be with infant seated with the back and feet supported. Avoid feeding infants while lying down on the back or the pillow. Adults that feed infants should be directly in front of the infant, making eye contact, in order to allow for responsive feeding. Preparing for drinking from a cup. Offer the child water or juice from a cup after 6 months and wean to a cup at 12 to 24 months. Early weaning may result in a plateau in weight due to reduced calories and constipation from low fluid intake. And changing from a bottle to a covered sippy cup with a small spout is not the same developmental step as weaning to an open cup. It's important to use open cups to feed your child because this open cup drinking encourages speech development in the child. Developmental readiness for a cup begins at about 6 to 8 months. An 8-month-old infant can enjoy trying to mimic drinking from open cups, which they see in the home. However, the ability to elevate the tongue and control the liquid emerges much later on, about 1 year of age. A 10 to 12-month-old child enjoys drinking from a held cup and trying to hold his own cup, even though the main feeding method is breastfeeding. So it's important to encourage the child. If they want to hold the cup and try to feed, it's okay, you can give the child this, whatever they want to play with. Early weaning may result in a plateau in weight due to reduced calories. They say that fingers were made before forks and hands before knives. So allow the infant to use their fingers. If they want to grab some food item to eat, as long as it is soft enough, it is well mashed, you can give the child. Food texture and development. Pureed foods should be introduced from 6 months, and the early introduction of lumpy foods may cause choking in the infant. At 6 months, the infant can be able to swallow very soft lumpy foods from about 7 to 8 months. By 8 months, this infant can be able to eat soft mashed foods. Fast foods. At 6 months, you can introduce the child to baby cereals. Rice cereal is hypoallergenic. At 6 months, fruits and vegetables, well mashed, can be given to the infant. And you have to only introduce one new food over 2 to 3 days. Many foods eaten by other family members are appropriate foods for infants who are about 9 to 12 months of age. Water. Breast milk provides enough water for healthy infants up to 6 months. All forms of fluids contribute to water intake. Additional plain water is needed in the hot, humid climates if the child is above 6 months. You have to limit juices. Juice is not needed to meet the fluid needs before the age of 6 months. Avoid tea and sodas. Sometimes parents are reluctant to say that they offered their infant sips from their own glasses containing soft drinks. So imagine giving a child a sip of alcohol during a naming ceremony. These are not healthy practices for an infant. A child that is less than 6 months should not be given any other food items apart from breast milk, which is adequate to support the baby in all that they need for growth and development. So how much food is enough for infants? Infants may vary in temperament. Crying or fussiness in an infant may be interpreted as hunger that will result in overfeeding. In the first few months, the oral need to suck is easily confused with hunger by new parents, and the typical forward and backward tongue movements of the infant's first attempts to eat from a spoon may seem to be a rejection of food by new parents. The infants may also appear to spit out the food, but this is a sign of learning to swallow and not necessarily a taste preference. It may appear to a parent that the infant does not like a food if he or she appears to choke. Fast foods may appear to be rejected due to immature tongue movements. Infants are able to learn food preferences, and also the flavor of breast milk is influenced by the mother's diet. So the breast milk and the breastfed infants learn different flavors earlier than the formula-fed infants. Genetic predispositions also contribute to the sweet taste and the rejection of bitter things. Food preference from infants also sets the stage for lifelong food habits. Inappropriate and unsafe food choices. There are some food items that are not healthy to give infants because they may cause choking. For example, popcorns, peanuts, whole grapes, guavas or raisins, gum and gummy textured candy, hot dogs or sausages, hard fruits and vegetables. They are not encouraged for infants. Nutrition guidance. Infants and exercise. Adult exercise and fitness does not apply to infants because these infants may be very weak and their bones are not yet ready for vigorous exercises, and so they may lack the strength and reflexes to protect themselves. A stimulating environment, however, is very important to allow the infants to explore and move as a part of their developmental milestones. Supplements for infants. For a mother who is anemic during pregnancy, iron may be supplemented from about 6 months. Vitamin B12 is recommended for vegans because vegetables and plant foods all do not contain B12. Vitamin D is needed if there is low sun exposure or if the child is exclusively breastfed. Common nutritional problems and concerns. Some of the problems involved in infants are failure to thrive, colic, Iron-deficiency anemia, constipation and diarrhea, dental caries, and food allergies. Failure to thrive, and this is indicated by inadequate weight or height gain. And here we suspect energy deficit. We have two types of failure to thrive, that is organic failure to thrive and inorganic failure to thrive. The organic failure to thrive is resulting from inadequate weight or height gain, which results from a health problems, for example, iron-deficiency anemia or a cardiac or genetic disease. Non-organic failure to thrive. This one is resulting from inadequate weight or height gain without an identifiable biological cause, and the environmental cause can be suspected. For example, maternal depression, mental illness, alcohol or drug abuse in the home, feeding that is delegated to siblings or others that are unable to respond to the infant, and also over-dilution of formulas. Colic, the sudden onset of irritability, fussiness, or crying of an infant who is growing unhealthy. Episodes may appear at the same time each day, and they may disappear at third or the fourth month. The cause is unknown but is associated with gastrointestinal upset, infant feeding practices. One theory also points to the mother's consumption of milk and specific foods like onions. And more scientific work is needed on the cause of colic, which is not yet clear at all. Iron-deficiency anemia. This is less common in infants than in toddlers. Iron stores in the infant reflect the iron stores of the mother. And iron-deficiency anemia is more common in low-income families. Breastfed infants may be given iron supplements and iron-fortified cereals at 6 months. Anemia can affect development of the nervous system, and this will cause learning delays. Diarrhea and constipation. Infants will typically have about 2 to 6 stools per day, and this frequency decreases as the infant matures. Some causes of diarrhea and constipation may be viral or bacterial infections, food intolerance, and changes in fluid intake. Breastfed infants have no problems, and infants fed on soybean-based formulas may have more constipation than those fed on cow's milk-based formulas. To avoid constipation, you have to ensure that the infant is getting enough fluids. Avoid medications unless prescribed for the infant. Diarrhea may be a serious problem, but you have to continue to feed the usual diet during diarrhea. Prevention of baby bottle caries and ear infections. Caries and ear infections are linked to feeding practices, and the risk for ear infections is also correlated with excessive use of a baby bottle as a bedtime practice, and this is as a result of the feeding position. Feeding techniques to reduce caries and ear infections. Avoid the use of bedtime bottles containing juices. Offer juice in an open cup. Examine and clean the emerging teeth. Food allergies and intolerance. About 6 to 8% of children less than 4 years have allergies. The absorption of intact proteins causes allergic reactions, and some common symptoms may include wheezing or skin rashes. Treatment may consist of formula with hydrolyzed proteins. Lactose intolerance refers to inability to digest the disaccharide lactose, and this is characterized by cramps, nausea and pain, and alternating diarrhea and constipation. This condition is uncommon, but it tends to be overestimated, and many infants may outgrow this problem as they grow. Vegetarian diets. Infants receiving well-planned vegetarian diets grow normally. Breastfed vegan infants need supplements of vitamin D, vitamin B12, and also possibly iron and zinc. Some key points to note. Infants born full-term and preterm infants born between 34 weeks and 38 weeks of gestation are the same in their milestones of growth, development, and feeding in their first year of life. The ability of infants to feed and eat is based on developmental skills that show readiness for the next step. Parents learn to read the signals of readiness from their infants over time. Energy and nutrient needs of infants are modulated by individual differences in the sleep and wake cycle, exposure to temperatures, and the state of health, among other factors. The priority is energy needs first. Protein and carbohydrates will be converted to meet energy needs if sufficient calories are not consumed, and this will slow down the growth rate over time. Growth as weight, length, and head circumference accretion is monitored and interpreted over the first year. The introduction of solid foods is also a developmental stage for parents in learning to read the signs of hunger, fullness, and food preferences in their infants, and also to know the safe food choices. The common nutritional problems in the first year, such as failure to thrive, colic, iron-deficiency anemia, and baby bottle caries are usually solved by combining parental educational, nutritional, and medical approaches. So this is all we had for this lecture. Thank you.